My name is Pritom and I'll be presenting my medical mystery with Vardan. Our topic is about this person named Randolph H. Pearson, who's an author and a former CIA analyst, and our medical mystery title is called He's Lucky His Iceland Vacation Ended in a Hospital. In illness, we know that Pearson has a long history of heart problems, which he previously suffered from coronary artery disease, and he underwent bypass surgery in order to treat the blockages in his arteries. Which following his surgery his condition actually worsened that resulted in more pain and health complications. And he consulted hundreds of doctors and specialists but was unable to find a proper diagnosis for this mystery illness. His medical history, we know that his illness first appeared in 2009, which he faced like shortness of breath and was just treated for asthma. And for many years he took like dozens of medications and consulted multiple doctors. And then one day he was advised by his doctor to visit the ER, which he later discovered blockages in four coronary arteries, which he took an urgent quadruple bypass surgery and learned he had been misdiagnosed years earlier. And this occurred because of a rare condition called balanced isnophia, which multiple arteries are affected, leading to false negative MPI results. After his surgery, Pearson developed an intensely itchy rash on his lower legs, which morphed into painful red spots erupting all over his body. And and years later, he suffered from like new symptoms, like periodic fevers that would rise up to 102 degrees. He had he experienced pain in like his joints, like in various of his joints, in the foot, in the wrist, the shoulder, and this lasted for days. Doctors struggled to identify whether his symptoms were drug-related or signs of an unidentified disease. He also suffered from a condition called hypernosophilia, which is white blood cell count would spike up 10 times above the normal average. Moving on to so what happened is years later, Pearson went on vacation in Iceland in September 2021. During his vacation, he developed a fever along with a swollen, painful right hand and experienced breathlessness, which as a result he became critically ill and hospitalized. And there his fever grew to 104 and tests revealed pericarditis, which is like an inflammation of tissue that surrounds the heart. And he had a right-sided heart failure, a blood clot in his lung, and chronic apnea. And moving on to medical terminology, our first term is coronary arteries, which is major blood vessels in the body which supply blood to your heart. And next is balance isnophia, a condition which blood flow is restricted to parts of the heart, which can cause false negative MPI results. And an MPI test is a myocardial perfusion imaging test, which shows how well blood flows to your heart. And we have hypernosophilia, which is when someone has high levels of eosinophils, a type of white blood cells in the body. And for pericarditis, it's an inflammation of the lining around your heart, which causes chest pain. A hypertensive crisis is when a person's blood pressure surges to an unusually high level. Vasculitis is an autoimmune disorder that causes inflammation in your blood vessels. Giant cell arteritis is an inflammation of the lining of your arteries. Vexis is a rare autoimmune condition caused by a genetic mutation which causes inflammation throughout your body. And eventually, Pearson was diagnosed with Vexis. And it's a mystery disorder that was first discovered in December 2020. And this is caused by a genetic mutation of the UBA1 gene located on the X chromosome. And this genetic defect is acquired and not inherited, which means it cannot be transmitted to offspring. And it's mostly men who are affected, which around 1 in 4,000 over 50 get this disease. And symptoms could be like a skin rash, pain and swelling, coughness and shortness of breath, inflammation of vessels. And these are my sources, and this is my presentation. Thank you.